Hello and welcome to the NESGP podcast, The Art of GP Locoming, and today I am joined by Dr. Helen Garr from Practitioner Health. Helen, welcome to the NESGP podcast.
Hi, thank you for having me.
And so let's get straight in then with about you as your doctor training. Take us through from when you qualified as a doctor through to where you currently are now, what your role has been and what you're doing now.
Of course. So, well, if I start with where I am now, we'll work backwards. So my main role currently, I am one of two medical directors of NHS Practitioner Health. And for those who haven't heard of us, we believe we are the biggest of our kind in the world, and we are a national confidential self-referral mental health and addiction treatment service for NHS staff. And we cover all of England and Scotland, and we're open to essentially any NHS health or care worker who faces a barrier to seeking confidential care. So that's my main job right now. So going back, so how did I get here? Well, we could take the whole podcast on this. So I suppose I start with, I went to my local comprehensive school where my children go now, and I was the first person in my whole family to even take A-levels or go to university. So things were a bit different for me. I always knew I wanted to be a doctor, but never had the confidence to do it or the self-belief. And I'm sure there's lots of people out there who can identify with that. Just didn't think people like me became doctors. So actually I took myself off to university, and I did a psychology degree, and my plan was to try and become a clinical psychologist. And in order to get onto a clinical psychology doctorate, you have to have some healthcare experience. So I started doing a bit of research as a psychologist. I worked as a healthcare assistant. And then I discovered that Nottingham University was running a pilot course that you could train to be a nurse in just under 2 years, and you were paid quite a decent amount of money to train to be a nurse. So I thought, well, why don't I just do that? I'll earn more money than being a healthcare assistant. I can get some healthcare experience, get a qualification under my belt. So I ended up qualifying as a nurse, and I absolutely loved it. Absolutely loved it. But I was frustrated being a nurse. I wanted a bit more. I used to go on the ward rounds with the medical students and the junior doctors, and I'd be at the back as the consultant would ask some questions, and I'd be jumping up and down, putting my hand up, wanting to answer the question. So actually, I then changed my career path and decided, you know what, I probably can do this, and perhaps somebody like me can become a doctor. And I went off and did graduate medicine, and I was part of the first cohort at Leicester University of healthcare professionals to go off and train to be a doctor in 4 years. So I did that, absolutely loved it, and then went through my junior doctor years, loved psychiatry, loved palliative care. In fact, I loved all aspects of medicine. It's probably quite unusual to hear people say this, but I just loved being a doctor. It genuinely was my absolute dream. And every day I would go to work and just feel so lucky that I was there and doing that. And as time went on, and particularly when I was nursing, so a funny story, I finished my last shift as a nurse at Nottingham City Hospital at about 9 o'clock on a Sunday night, because I worked as a nurse all the way through medical school to fund my medical school. So I had a house, I'd been working as a nurse for a few years before I went off to medical school. So I had responsibilities. So I worked as a nurse all the way through my medical school training. And I worked my last shift as a nurse at 9 o'clock on a Sunday night on the surgical admissions unit at Nottingham City Hospital. And I went back at 7:30 on the Monday morning to the same ward with the same team as the FY1. Or the JHO at the time. So it was a funny old thing. So through my years working as a nurse and working with doctors, and then as a junior doctor, I just developed this interest and this passion into who is caring for the carers, who's looking after the doctors. And what I saw was we give everything of ourselves. We're trained to give everything as doctors. It's sort of our unwritten curriculum that, you know, you give your heart, your soul, your life to this career, and we do it willingly. But what I saw was that the negative consequences of that. I saw my colleagues burning out, I saw them becoming unwell, and really sadly I saw close colleagues died by suicide, which was really traumatic and had a real profound impact on me. So I knew from, actually before I even became a doctor, I knew from when I was nursing that I definitely wanted to do something to support my colleagues in the NHS. So from a very early stage, I knew that I was going to end up doing something like I'm doing now. So I went through my training, I became a GP and developed my interest in practitioner health, really caring for my peers, and ended up where I am now. So I came to work at Practitioner Health as a clinician, and eventually ended up taking over from Baroness Gerarda, the founder of our service, as medical director of NHS Practitioner Health.
Practitioner Health is kind of it's the organisation for looking after medical professionals at this sort of level, but you had identified a need for it way back, even before it even started.
What was really funny was after my GP training, NHS England were at that point, and I think still potentially are, running fellowships for newly qualified GPs, and I was able to get a fellowship, and my project that I developed was to develop some kind of practitioner support service, practitioner health type service for doctors. And I started doing this project, and in the course of this work, I then said, what else is out there? And actually at that time, Claire Gerarda had started doing something very similar. She was in London and was looking to branch out nationally to all GPs. So I linked in with Dr. Gerarda, realised that I was trying to do something she was a little bit further down the line with, LinkedIn, and she's such a champion for people with a passion and people with drive. And Claire took me on board, and I was able to then bring my skills and my passion and my interest into practitioner health. So Claire was a little bit further along the line, but yeah, you're absolutely right. I like to think, had Claire not already done it, perhaps I might have got to the same place regardless.
And in your role then in practitioner, you actually yourself, although you're the sort of the clinical director, you're actually still seeing clients, as it were. You have patients as such.
Yeah, so my medical director role involves holding my own caseload. So I still do see patients. I often tend to see sort of high profile people, or really senior leaders will tend to come onto my caseload. Yes, so as long as alongside making sure that our staff are the best they can be and well supported, and our service is excellent, which it is excellent. I'm so proud to work there. I still work clinically. I also still work as a GP. So in order to stay on the performers list, I work in out of hours. So I work in our local out of hours service in Nottingham, which I absolutely adore and love doing, and it's such different work, and feel like I make a real difference there and love that work. And I also sit on our local LMC as our wellbeing lead. Alongside all of that, if that wasn't enough, I also run a business, a speaking business. So I speak often in the corporate sector and the NHS around leadership and wellbeing and mental health.
Okay, good, amazing. And in back in your role with as a clinician within practitioner health, I think you describe yourself as a mental health organisation, but is there an overlap there? Are you using your GP smarts in this role, or is it much more along a sort of your psychology base?
No, so we're a primary care led mental health service. So we're predominantly GP led, and our clinicians are predominantly GPs with a special interest in mental health, which was definitely me as a GP. So I spent many years working at Nottingham University. Again, I've been so fortunate to work in the most fantastic places in my career. And I definitely developed my interest in mental health working at the university. So the GPs who work with us are GPs with extra qualifications or additional expertise and interest and skills in mental health. We do also have psychiatrists that work with us as well, and we have mental health nurses, but we are a primary care led service. In reality, the care that we deliver and the treatment that we deliver probably sits in between primary and secondary care by nature of the expertise that we bring. And it, honestly, I say this all the time, it blows me away that the quality of the clinicians, well, not just all of our staff, but if we're looking at clinical care, the quality of the clinicians that work for us are just all top of their game. Then the knowledge, the expertise, and the compassion that they bring genuinely just blows me away. So in reality, whilst we are a primary care led service and we bring the treatment you would expect if you were able to go and see your GP, and the reason people come to us is because they don't feel able to do that for various barriers and challenges. We in reality, we sit between primary and secondary care in the care that we deliver.
And you mentioned, you said GPs with extra qualifications. What is that extra qualification that a GP listening to this might actually then be able to do and be eligible to join your team?
So the GPs that work for us, who in the main it's additional expertise and skills that they've built up through their day-to-day practice. So if you are the GP in your practice that absolutely your heart sings when you see you have a mental health consultation on your list, that's the kind of GP that works for us. And we know that many people don't. Many people see it, that might not be something that makes their heart sing, but for me and for my colleagues, I just love that. So it's in the main, people have developed their expertise through their day-to-day practice. They become the go-to in their practice. Many people have taken on extra roles, perhaps as mental health lead or ICB lead. Many of our GPs have expanded their skills and they've got coaching qualifications, for example, or some additional skills in well-being. It's actually quite difficult to get additional qualifications in mental health. There is a master's out there that I'm aware of. And obviously there's little pockets of courses, but there isn't a standard training course that I am aware of that exists to become a GP with a special interest in mental health. It is something that I'm going to be looking at, though, hopefully with the RCGP. It's on my list of things to
well, if they're listening,
yes.
and okay, so and as an organisation, are you often recruiting new clinicians to join you, or is there a waiting list to join you? How does that work?
Yeah, so we recruit regularly. We've actually just had a recruitment drive. We advertise in NHS Jobs. We'll put it on our social media and on our website. But we over the last few years, we've recruited once or twice a year. So we regularly recruit. People tend to only leave us when they retire, which we're very proud of. Yeah. We don't have a big turnover rate. What we do find often is people will come to us towards the end of their careers, because when they're starting to look at sharing their expertise and their skills. But certainly in more recent times, we've had much younger GPs come to us who want to develop their skills. They have this interest, this passion, and they want to train with us and learn with us. But yes, so keep an eye out on our social media and on our website for our next recruitment.
Doesn't just sound so much as an organisation, but actually almost like a career choice. Or it's a career type option where you can, for GPs, I guess the numbers aren't massive, but where you can actually do this very niche supportive nuanced role.
Absolutely. And alongside that, though, many of our doctors and all of our clinicians, but many of our GPs in particular, come to us as part of a portfolio role. So especially in the early days, many of our GPs would have portfolio careers, some would be locums, they'd have lots of other jobs, and this would be part of their portfolio career. We are definitely seeing a move to GPs coming to us and making this the mainstay of their career, because we are a fantastic place to work, and the work that we do brings so much purpose, and we really do make a difference. It feels good to come and do this kind of work. So we find people are certainly wanting to spend more of their time working with us.
And I imagine it obviously it cross fertilizes with our general just NHS practice, doesn't it? As
Yeah,
GPs, it's the
absolutely.
experience and the skills we bring up. Okay, so obviously it's 2026 now, how much of this is through Zoom? These sessions through a webcam, and has it moved? Has it shifted from in person?
Yeah, absolutely. So pre-COVID, we did all of our work was in person, and we still have clinicians all over the country who would see practitioners who wanted our support in various places, GP surgeries, mainly across the country. We had to do a massive overnight shift during COVID,
Mm-hmm.
as did many people, in order to be able to carry on providing our service. And we shifted very quickly to providing online support. So we offer both currently. Most of our clinicians who come to us for support choose to have online. Most people want online. It's really convenient. It means if you are a clinician up in Newcastle, you can see a clinician down in Cornwall, and you absolutely know there's going to be no crossover, no conflict. You're not going to know each other. And it means for accessibility, it works really, really well. It means we can deliver far more appointments. However, there are cases where people either need or choose to be seen face to face, and we can absolutely facilitate that.
And this brings me on to I think the final question about practitioner health in terms of I think I think for the last couple of years there's been this real shaky situation around the end of the year when it comes to your funding. Are you going to be funded for the next year? That must be be so stressful for you. Are you still going to have a job? Are you still going to be able to keep on your staff? So and I guess
Absolutely.
going webinar might have some cost savings and allow you to have more practitioners, I'm guessing.
Yeah, the primary benefit is around access. It means we can see far more people at the time of their choosing, which it has made our ability to deliver care so much more impactful. You're absolutely right about the funding. We've been going for almost 18 years now, and like most NHS services, we don't have long-term sustainable funding, and that would be wonderful. We have, however, just announced we have had our contract extended for a further year, which is fantastic. Yeah, and we're really, really pleased about that we're able to carry on delivering this service.
No, that's fantastic. And going in terms of looking forward, I guess, where do you think we're heading then as a profession within primary care in terms of and I don't expect you to have the answer to this or the data necessarily, but where are we going in terms of the workload, burnout? Are things getting better? Are things getting worse? Is there hope? Is there more we can do? Should we stop doing some things and start doing different things? Where do you see? Have you got
Well, I can tell you
thoughts
what I see from my role at Practitioner Health and what we see. First of all, there's always hope. There has to be hope.
So
And
Aragorn from Lord of the Rings.
Yes, there always has to be hope. And actually, we all get out of bed in the morning, we choose to go to work, we choose to go, and we go to work for a reason. So there is something for all of us that keeps us in this job. That said, what I see at Practitioner Health and what we see is that people are under the most pressure they've ever been under. Workloads are the highest they've ever been under. And for GPs in particular, it's a very, very challenging time right now. There has to be changes. What we are as general practitioners, we're really, I hate to use the word agile, it's one of those blue sky thinking words, the corporate word, but we are a really agile profession. That's what we're great at. We're great at adapting, responding, and as a profession, we do need to adapt and respond to the pressures that we're under and the way that general practice is delivered. And I see my general practice colleagues constantly innovating, thinking, moving forward. I don't have all the answers about what should happen in general practice, but what I do have is the observation of the pressures that my colleagues are under. And it's so important that we have the outlets to be able to have the support when we need them, to be able to look after ourselves, to be able to actually go to work and do the job that we were trained for and that we deserve to be able to do. So I just want to acknowledge, I absolutely recognize 100% the pressures that everybody is working under and the brilliant job that people are doing despite all the challenges that general practice is facing at the moment.
And as a GP listening to this, and and we might be listening to this because we might be through ourselves be going through some anxiety or burnout or exhaustion. What in your experience are you able to identify? I mean, I guess there are some from which we know from research and clinical practice and everything. But personally, have you been able to identify in your client base particular factors that were early precursors, early signs of looming impending burnout? That if we're listening to this, oh, actually, that's happening to me now. Maybe I can start to do something about it before I come to the edge.
Absolutely great question. So what we often see in GPs, particularly because most of us are perfectionists, we're high achievers, is that we give everything to our work. Our work comes first. And what we do is we give until we fall off that cliff and we crash. And often the point at which people recognize they need some help or things aren't good is when things have got really quite bad. What we know with burnout in particular is we can pull ourselves back from that cliff if we just train ourselves and take the time to notice in ourselves and our colleagues when people are heading towards that burnout cliff. So the really common signs that we see that sound really obvious when I say them, but we don't always recognize them in ourselves or others. So thinking about work all of the time, not being able to switch off is a really, really common sign of heading towards burnout. So for me, if I talk personally, I remember when I first became medical director at Practitioner Health, there was a lot of work to do. I was working really hard. I was working really long hours. I was living, breathing this job, and I believe in this job. So I was giving everything to this job. And I remember going on holiday and I was sitting on a beach somewhere. I can't remember where it was, but I distinctly remember sitting on a beach under a palm tree with my laptop, sending emails, and my co-medical director messaged me. I don't know if he'll even remember this, but I do tell this story often, and said, "Helen, stop." Just stop. And he said, look, when we take leave, we need you to recharge, to restore, to re-energize. We need you to come back after your leave, ready to go, fully restored, fully re-energized. And if you are not using your leave to do that, it just defeats the object. You might as well not go. And it was a real wake-up call for me, actually, thinking, well, the whole purpose of my leave is to restore my energy, to, allow my brain to recover. And actually, if all I do is keep working and working and working, and I'm still not great at it, but I've had to put real strategies in place to allow myself to switch off, not just in my annual leave, but in the evenings as well. And I think that is a big, big sign, inability to switch off. So thinking about work all the time, sending emails in the middle of the night, getting in earlier and earlier, staying later and later. Another big one's brain fog. So when we are at our best, we're clear, we're sharp, we're confident, we're making these decisions, we know we're good at our jobs. When we're starting to feel overwhelmed and burning out, we get this brain fog, we lose that clarity. I mean, we've all been there, that, you're doubting your decisions, you're looking at that task 3, 4, 5 times, that blood result, you keep coming back to it, you can't decide what to do with it. So brain fog, difficulty making decisions, lacking confidence, self-doubt, the days when I think, oh, why am I even a doctor? What am I even doing here? Is a real sign for me that I need to pull myself back. Other common ones are drug errors, making little errors, little mistakes, not necessarily catastrophic, not necessarily big mistakes, but little mistakes. You might have, patients start to niggle about you, your colleagues are starting to niggle about you, aches and pains, catching, our immune system takes a dip when we're burnt out, our T cells drop, so catching everything that's going, headaches, self-medicating is another big one that we see. So, starting to have a glass of wine every night, it might become a bottle of wine, taking up smoking again, over-the-counter medications. We do see people come to us at Practitioner Health. Codeine use is quite a common one that we see, over-the-counter codeine or from the drug cupboard, things to help us relax and switch off. Affairs are a common one as well that we see. Stopping doing the things that we know keep us well. So talk a bit more about the wellbeing plans that we use with our clinicians at Practitioner Health. But when we stop doing the things that keep us well, so and that going to the gym after work or seeing friends becomes that glass of wine, isolating ourselves is another big one. I would say probably the biggest thing that I see in burnout is compassion fatigue. So when we stop seeing our patients as people, when we stop caring about our patients, that is an absolute huge one as a sign of burnout.
Wow. When I asked you this question 5 minutes ago, the way you couched it initially was you used the words about as GPs, we need training. We need training to recognise this. It wasn't intuitive. It does to me. That I thought that's not intuitive. And then you said you were sitting under a palm tree, so I guess not Bognor. And you were, and then your colleague emailed you back. Now, and everything else you said again is about how we recognise it in ourselves. But I'm thinking, you about drug errors and other errors and things going on and self medicating and stuff. These are also things that we as GPs can recognise in our colleagues, and so maybe our colleagues have a role in helping us as individuals notice these burnout, this impending burnout.
100%. So I talk a lot about checking in with ourselves. So getting into the habit of checking with yourself. So how am I doing today? Doing a well-being audit. How am I? So you could use a red, amber, green traffic light system. You could use a number system on a 1 to 10. Just getting into the habit of where am I? Am I red? Am I amber? Am I green? What do I need to do to pull myself back towards the green? When was I last in the green? Am I consistently in the red? What's going on? We can talk more about that later as I keep mentioning these well-being plans, which I'm really keen on. But not just checking in with yourself. Get into the habit of checking in with your colleagues. So I say often, and Neil Greenberg talks a lot about this, if you check in with your colleagues, if I was to say to you, or how are you? What do we get back? I'm fine. That's what everyone says. I'm fine. So we say I'm fine. 1, because we haven't got time. 2, because does that person really care about us? Do they want to know the answer? 3, we can feel shame saying I'm not fine. We're supposed to be these superheroes, aren't we? That's what we're taught, aren't we? We're superheroes. We don't get on well. We cope with our 40 patients a day and our 3 home visits and our 500 blood results and tasks and letters coming in. We're meant to cope. So to say I'm not coping can come with feelings of shame. You ask somebody how they are, you likely get back, I'm fine. What it can be really helpful is ask twice, ask over time. So how are you? I'm fine. How are you feeling? I've noticed you've been a little bit quiet. I noticed you've not been yourself. I noticed you sent that email when you're on holiday. I've noticed you've been a bit snappy. I noticed you had that drug error. How are you feeling? Now, people still might not answer at that second question. Ask over time, because it takes time to develop trust between colleagues, and people do feel shame. I've certainly been asked by my colleagues in the past, Helen, we're worried about you. Are you okay? And I've get lost. How dare you say that about me? But actually, over time, when they've come back again, how are you doing now? How are things? I've appreciated the masking. So that takes me into a whole sort of separate segue about how do we develop these connections between our colleagues in order to develop trust and psychological safety, so that we can say, actually, I'm not feeling so well, I'm not doing so well, I'm struggling a little bit. And that is a whole other podcast, but taking the time to get to know the people that we're working with. And if you're locuming, that can be incredibly difficult. But if you're listening to this and you regularly have locums in your practice, for example, being intentional about, I would always knock on my locum's door. Hi, how you doing? I'm Helen, anything you need, if you want to get a coffee later. And the amount of locums who would say to me, no one's ever done that before. So being intentional about connecting with the people around us, just how are you? How was your drive today? Do you fancy a coffee? Oh, I love that. I love that top that you're wearing, Richard. Where did you get that from? It's great. Just making these small, meaningful connections help develop trust, which means that if somebody says, how are you? We're more likely to get a response. And we know that if somebody says, how are you? I've noticed you're not yourself. People are far more likely to seek help if they've had a little nudge from somebody else.
So interesting, isn't it? And it's actually, how much would it cost to develop a big poster and send one out to every GP surgery's coffee room and stick that on the wall? And so for those practices that do meet for coffee, you should all meet for coffee. When you do meet for coffee, there's that big poster giving those prompts, because it's quite difficult to ask those questions, but it's even more. But it's even more difficult, I think, as an individual to ask yourself those questions. So to have people, and I was shivers down my spine as you were saying, going through the importance of the colleague asking you those questions, because of course that would naturally, it's quite annoying. I'd find that quite annoying, but actually, really, really a productive, proactive way to help start a colleague to be able to support themselves and think about those options.
Absolutely. And I think it's the reason we don't do it is if you don't know somebody well, it can be hard to ask, which is why it's important to develop those relationships with the people that you work with. So, we have each other's back and we are looking out for each other. And, I talk about, I don't know if it's politically correct to say, but work wife. So my work wife and when I work full time as a GP, I'm sure she won't mind me saying her name, Rachel, amazing GP. And actually, we had each other's backs, and we'd look out for each other. She knew my signs when I was struggling. I knew her signs. If I was on call, I'm sure I'm not alone. And as a GP, on calls were my worst. I'd start to get a migraine the night before. This anticipatory anxiety before I'd even done the on call. And sometimes they'd be fine, but I really dreaded on-calls, and I was never at my best when I did an on-call. I have the self-awareness to know that. But I'd get to work, there'd be a Mars bar on my desk, there'd be a coffee, I'd get a screen note, how you doing? I've seen you've got patients waiting, I've taken a patient for you, come on, we're going for a walk, I am dragging you from your desk, we're going to have a 5-minute break.
We all need a Rachel.
We do all need a Rachel, we do. And, she had my back, she knew what my signs were. Something we do at Practitioner Health, we offer buddies to all of our clinicians when they start. So we call it a clinical companion, but like a buddy program. And that's something that definitely through COVID, the evidence showed us helps, having somebody a bit like Neil Greenberg again, who's amazing. He talks about in the military, how we can learn from the military. They have, I think it's the Navy, they call it your op, your opposite number. So you're assigned somebody who's your op. So somebody who's got your back, who looks out for you. They're not there to counsel you. They're not there to treat you, but they're just looking out for you. We've tried to replicate that at Practitioner Health with our companion program, and people are offered the option to have a buddy. We find that happens informally and naturally anyway. People create these sort of networks looking out for each other, but it can be difficult in general practice, which can be very isolating. So it's important to be intentional.
I was just looking through the Royal Medical Benevolent Fund's paper, which they did. It was back in 2010 on support for sessional GPs and professional isolation. So little has changed. And I'm almost thinking, how could we as an organisation somehow create a buddying system for these isolated locums to kind of just check in once a week and ask those annoying questions.
Oh, wow, I like that. I'll tell you something else Rachel did. If she ever hears this, she'll be horrified. She came up with an idea. We worked in a really large practice, and it was a great practice. You know, it was really, the values were right. Everyone was brilliant. I think at the time, I think there was about 15 GPs and additional nurses and receptionists. But it could still feel quite isolating, even though we're a massive practice. And part of the problem was we had fire doors, so we couldn't prop our doors open. It was a new building, and the regulations meant every door to your consultation room was a fire door. So it meant your door was constantly shut. And we were like, how can we, we don't want to be knocking on people's doors, but we're losing this, corridor interaction. And we thought, could we get lights above the doors, like a green light, whatever? Rachel came up with this really simple concept. This is how far back I'm going. It's when we had leaflets and surgeries. And I think it was the contraceptive leaflet we used to have I sound really old now, but there was a leaflet about, these are your contraceptive choices. And it had a big green circle on the front as part of the design. Rachel cut out the green circle and she blue tacked it to her door. And she said to everyone, when the green circle is on my door, I'm available for chat. Pop your head in, say hi, come and grab me for a coffee. I'm available. I want to see people. And it was just brilliant. And loads of us sort of took it up. We ran out of contraception leaflets. but it was just such a simple, brilliant concept. Just how do we facilitate the interaction? So at Practitioner Health, we have, because we are all across the country, so we've had to really be intentional about how we connect our staff, because we know that is fundamental to be able to work well, is to be connected. One of the things we do, we have a daily tea break, 11:15 every single day. It happens online. If you can come, we just come, let's replicate our morning coffee in a surgery, talk about what you want, talk about your work, talk about your holidays, what you had for your tea last night, whatever it is. And I don't always get there, and I'm so passionate about it. And I am human also. I often think, I've got to get this worked and I can't go. But the times I get to that tea break, honestly, the best 15 minutes of my day, seeing my colleagues and the conversation. I always come away with a book recommendation or a podcast or something new to do. But it inspires me and it motivates me and it energizes me for the rest of my day. So
again, we're really taking that idea as NASGP. We're going to do that. But you've just mentioned about your. So as we're for the last few minutes, then let's talk about your reading and podcast. What do you do? We finished with Dr. Garr. Now we're over to Helen. Helen, what do you do to recharge, to prevent burnout? What are you reading at the moment? What do you get up to?
Right. So I'm not perfect in this. As I say, I'm not great at switching off. And I've made my peace with that a little bit, in that I'm so passionate about my work and I love my work. I've made my peace. However, I am also intentional about knowing I need downtime. Part of what I did a little exercise, an audit exercise about what's important to me, what matters to me, why am I doing this? And I think if you ask anyone listening to this podcast, if I was to say to you, what matters most to you in life, most people would say family and friends. I would say we probably wouldn't all say work as number one. Yeah. Yet if I was to say, where does your time and your energy go? Does it match? Do your priorities match? Actually, are we putting more of our energy into work than we are into our family and friends? So that made me realize perhaps I wasn't being as intentional as I should be with my family. So I do try every evening to at least have a conversation. I've got teenage children. It's incredibly difficult to have a conversation with teenage children, as anyone might know. But I try to be intentional when they come home from school, stop what I'm doing. I look at them, make eye contact. If I come in from work, my poor dog that's been waiting all day to see me, I sometimes would just rush past, get on to what I'm doing. I'm intentional about being present with the people that matter to me. Even if it's only for, half an hour or so, I would try to be present rather than my brain being everywhere else. And there's a really great podcast on this. oh, I forget the guy's name. I want to say Adam, somebody. It's called The Third Space. And it's
Okay.
about how do you show up after work, being the person you want to be. So my dogs are very important to me. I've got two chocolate Labradors called Eileen and Barbara. So Eileen, I have to shout, "Come on, Eileen," when I take her for a walk. Barbara, and I know that the days I don't walk my dogs are the days that don't go so well. I absolutely love being outdoors. I really, really cherish being outdoors in nature, even on really grey days. So whenever I can, I'll try and spend time walking outdoors or just even just having my coffee in the garden. Friends, very important to me. Don't see as often as I would like, but try to be intentional about seeing my friends. And I really enjoy travel. And if I ever am not working as a doctor anymore, I think I'd probably set myself up as a travel agent, because I have a really special skill of finding really, really great, cheap holidays. So I like to travel and use my annual leave wisely to travel. What am I reading at the moment? So I'm one of these people that has about 5 books on the go at any one time. But one of the books I'm really, really enjoying reading, I've just finished it, so I'll give a plug. It's by Richard Duggins, who is a psychiatrist that works for us at Practitioner Health. He is phenomenal. He has just published a very successful book called Burnout Free Working, and I've actually really enjoyed reading that. Another book, again, not a fiction book, but I've really enjoyed reading How to Have a Good Day, and I forget the name of the author now. I can come back to you, but it's called How to Have a Good Day. Elizabeth somebody, but I've really enjoyed reading that too.
Well,
yeah.
We'll get the name of that. We'll put that on the podcast show notes. Helen, thank you so much for running through your career path and what your role is, and I think a really interesting conversation there on your insights into the health of practitioners. Really interesting, and so much scope for support there. So thank you once again. Thanks for your time. Thank you for all that Practitioner Health does, and your leadership of it, and the amazing team you have. You sound like a wonderful organisation to work for, but also a wonderful organisation that people can approach for support. It sounds like any of us being in this situation can really get the support from you for that.
Yeah, and I wonder if I could just end on saying that about NHS Practitioner Health. So if anyone listening to this is thinking, actually, do you know what, I'm not quite right, I recognise some of those things that Helen's just said. You might be out there thinking, well, am I not deserving of coming to Practitioner Health? Am I not well enough? Well, actually, we know that the sooner you come to us, and we wrap you up, and we listen, and we care, and we help you, the sooner the better. So there is not unwell enough to come to us. If you think things aren't quite right, please do reach out. It's self-referral only. Most people come to us via our website. It does take about 10 minutes to fill in the form. We know that filling in that form is a really brave thing to do, to sit down, and we understand how hard it can be to put yourself out there and say, actually, I want some help. But we do offer absolute brilliant treatment. We've got access to fantastic therapists, CBT, psychotherapy, brilliant clinicians who can offer medication, time off work, anything your GP would usually do for you, we can do. But most importantly, we get it. We're all working clinicians. We absolutely get the challenges that GPs are working under, and we're here.
Helen Garr, thank you so much for going on the podcast, the NESGP podcast, and thanks for listening, everyone.